All right, good afternoon and welcome to the webinar today, Doulas, a valuable part of the care team. This webinar is presented to you by a collaboration of the Minnesota Health Plans, who are working together to ensure a healthy start for Minnesota children by concentrating on improving services provided to pregnant people and infants, with a particular focus on reducing racial and ethnic disparities. The health plans who are collaborating in this project are Blue Plus, Health Partners, Hennepin Health, Medica, South Country Health Alliance, and UCare. So today's webinar is being recorded, but you'll also be able to view it later on the Stratus Health website. A link to the recording will be sent out when it's available, and you can absolutely feel free to share it with others who couldn't join us today. We ask also at the end that you complete an evaluation following the presentation. It'll display as you log off the webinar. By completing the evaluation, you'll receive a certificate of participation, and we really do value your feedback, and we want to hear also suggestions for topics for future offerings that would be of value to the community on the topic of maternal and child health outcomes in particular. So during today's presentation, there'll be lots of time for questions. So you can either enter your questions in the chat, or you can raise your hand on the Zoom, and you'll be unmuted to ask your questions. And so we can have an awesome back and forth conversation. So now I'd like to introduce you to Akmiri Sakara and Katie Crawford, who'll be doing the presentation today. Akmiri has been a childbirth attendant for over 30 years and is the Chief Family Development Officer and Health System Navigator with the Cultural Wellness Center, a perinatal education trainer for the Common Sense Childbirth School of Midwifery School, a board member for Everyday Miracles, and a doula in service to the Twin Cities metro area and the Minnesota Breastfeeding Coalition, and a co-chair for the Integrated Care for High-Risk Pregnancies, which lots of people know as ICHIP. And Katie supports families in pregnancy, birth, and postpartum as a lactation and childbirth educator, birth and postpartum doula, and baby wearing educator. And we are super honored to have both of them share their wisdom with us today. And I'm going to turn it over to Akmiri and Katie. Thank you.
Well, hello, welcome. Hi, Katie.
Hi, hello, everyone.
Hello. So we're both very, very excited to be here with you today and to talk about something that we both love very, very much. And we are both two women who love to talk about our work, but we also love questions. So we're really good at answering questions too. So we're just gonna briefly go through these slides that we have, and we are so ready to talk to you just about our work, and our work especially here in the Twin Cities, because we both do a lot, and we work with many different communities, and so we're excited to be here. So could you advance, please? All right, so what you see before you is really talking about the maternal mortality problem that's here in the USA. And we're going to be talking about the Twin Cities too, but we kind of want to just give an overview of what is going on. So you can see here where the rate of women dying is rising instead of falling. And so we are both working really hard to try to change those numbers here in the Twin Cities. But you know, this has been going on forever. It's not something that just happened. And so we are really trying to change this. And so you can see, in addition to the 1,000 women who die in pregnancy or during childbirth each year in the US, nearly 35,000 women here suffer from serious complications leading to long-term health problems. So Katie, is there anything that you want to say just about this maternal mortality rate?
Even though it's like a overall very large issue, we also have to look at the fact that for Black and Indigenous women of color and people of color, this rate is even higher. So what you see here is yes, a very high rate, but for non-white birthing people, this rate is astronomical. So
Yes, definitely. Advance, please. So just goes in just a little bit deeper. So we're talking here just about the maternal rate for African American women is 47.2%, and that's per 1,000. And compare those rates to that of European American and Hispanic women, which is 18.1 and 12.2 respectively. And so the preterm birth rate for the US has declined over the last decade, but for African American folks, birthing people outcomes and the outcomes of other races, it's still very, very high. So babies
high.
of Black women, regardless of their mother's education or economic status, are twice as likely to be preterm and have low birth weight. And so we're both doing things here in the community that really addresses that. What else do you know about this, Katie?
yeah, because a lot of this is, you know, competent care before having the baby. And so a big thing about having a doula, which we'll talk more about in a minute, but like having that person with you through that, all that process that can help you look for these things. Like, you know, maybe you should talk to your doctor or your midwife and like really push the issue so that we're making sure that these things aren't continually happening. Because a lot of it is just not communication so much on the person having like the pregnant person, but like being heard. So maybe they are expressing it, but it's just not being heard. Or there's like a very big, what's the word? Black women especially are supposed to be like strong, you know, not allowed to like feel things or have emotions or, you know, be quote unquote weak. So we're not listened to as much as like our counterparts and like our other people having babies in other races.
It's very true. And so having an extra support person be present really does help in that. And knowing that the different hospitals that we have here in our area are usually pretty receptive to having that extra support, because if we're there, then they don't have to worry so much about their participant or their patient. They don't have to worry so much. So could you advance, please? So whereas I really liked this statement, whereas the midwife, OBGYN, physician and or the labor delivery must focus on facilitating a healthy birth, the birth attendant's main concern is to facilitate the birthing person's comfort, well-being, and parental readiness, and provide support also to the partner and extended family. And so that is, I know for myself, that's really, really important to me, to be able to support the family. So we act all as a birthing team to have the kind of birth that they want to have. So,
yes, and my clients, I always tell them, you know, there are people who are looking out for the baby to make sure baby's healthy and safe. I'm making sure you're healthy and safe. Obviously I'm not like a medical provider, but I can see signs and stuff where I can alert someone like we need to be paying, you know, I'm there for the, like Akmiri is saying, for the like the more family unit, whereas providers and nurses are usually more focused on like making sure baby's, you know, okay and all that. Like baby's usually okay. Yeah.
So during these COVID times, it has been kind of difficult to be present just because of COVID. There might only be one support person allowed. And so that makes our work just a little bit more difficult. And so it's important that we're able to do virtual if that's all possible, or really try to help our families stay home as long as possible before they go into the hospital if there's nothing concerning that's going on with the mom, to be able to support them through that birthing process. And I also am a national trainer for the Common Sense Childbirth Institute. And so when I work with people and train people to be doulas, I talk about that too, about trying to connect with people virtually as well as in person, and how that happens, and try to remind people, even with their educational ways that they work with families, that they have to keep that kind of stuff in mind. So
Yes, definitely. Great.
yeah, so advance, please. So what is a doula? So what you see before you here is the term comes from a Greek word meaning to serve. So a birth doula serves and supports expectant parents and their families with the emotional, physical aspects of childbirth. And then I'm talking about a postpartum doula too, because I think at this point in time, postpartum is starting to be more important than prenatal and working with somebody prenatally, because there's so many things that can happen during the postpartum period. And so postpartum doula serves and supports after childbirth. And so birth and postpartum doulas can assist birthing parents and their families in getting information to make the very best health care decisions for themselves and their families. That's basically the work that we do. And our work is honored and is followed in many different traditions. And I think that what we do is takes off some of the pressure from the medical practice.
Yes, definitely. I mean, or it should.
Yeah, or it should.
I'll be honest, there are some hospitals I will not take clients at, or will strongly encourage them to switch to a different facility just because of, I want to make sure that they're safe and getting the best care. And so I'm very honest about that with my clients. I'll tell them, like, I'm doing you a disservice if I'm not honest with the way I've been treated, past clients have been treated at these facilities. And my main concern is keeping you safe and keeping your family safe. So yes, and I'm also a postpartum doula as well as a birth doula. So I do overnights mostly. I'm coming off an overnight last night, but I used to not think that postpartum was my calling. But it's funny what birth work does to you. But I have 4 kids. And so my youngest is 18 months and I had a really hard postpartum with him. And it really, it really changed my outlook on how important postpartum is. Mm-hmm. And so now, like Akamiri said, like postpartum is just, if not more important to have like support in than like prenatally. So when people are like working on their birth plans, I'm like, and we got to work on a postpartum plan because we got to do both.
And postpartum is just not 6 weeks.
Yeah.
It can be a lot longer than that. It can be up to a year that you might have to follow somebody, work with somebody. I'm really thinking and working toward working with people even beyond that, providing parental kind of support for people. And sometimes people have other babies in between that. And so really being able just to support them as much as you can. So being that that birth team for a longer period of time.
Yes, I always tell my clients, I'm your doula for life. So you can always call me or reach out to me with anything.
Mm-hmm. I like that, Katie. I like that a lot. That's a good way to put it. Because this process, they talk about, you're prenatally for that 10 months, but you're postpartum the rest of your life. So so being able to stay with people. Advance, please. All right. When you hear the word doula, we want people to think about and know. And so I just wrote down some different kind of words that when you hear that word doula, that this is what you're talking about, and what you might hear. This is what we want you to hear instead of hearing the things that are off. So I see a question. I'm curious if MA covers doulas for PMA. Oh, well, that's a whole different ball game. All right. So I know that we both have worked a lot in the legislative area, just as far as doulas are concerned. I know I've been working in the legislatively for doulas for, geez, it's been over 10 years, really trying to get what's on the books to be able to reflect what we need. At this point in time, there is third-party doula reimbursement if you're on the doula registry, if you've been trained by a certifying organization that happens to be in our legislation. We are working on correcting that at this point in time. Talking about legislative stuff and about whether or not the third-party reimbursement happens is a touchy subject with a lot of doulas. And so it's something that's continuing to be worked on. Yes, it's covered, but is it covered? There's a lot of different hoops that you have to jump through.
Yeah.
Especially if you're not on the doula registry, or if you're been trained by an organization that doesn't happen to be on our registry. So that's
I do have
what
clients
I
who
can
use
say.
HSA though.
Pardon?
I have had clients use HSA.
Have you?
Just not MA.
Okay.
Because HSA is more out of like their pockets, kind of like it's like a collaboration of dollars, I feel like. And so I also think it just depends on your workplace. Some HSAs will, some HSAs do not. So it depends on what the governing insurance board decides if it's okay.
Yes, it's very true. So, yep, you're welcome. And so, so these are words. You want to say anything about any of these words? Anything stand out to you, Katie?
Oh my gosh, so many. I trust, like your clients have to trust you. Angel. Oh, all of these. I love memories. I still have clients who send me like text messages of their babies, like that are now toddlers.
You haven't lived until you have a picture from a college graduation.
No,
so
I'm not ready for that. I'm not ready for that.
I have that. Because so people know I've been a doula for 30 years here in the Twin Cities. I think I was doing it when a lot of people who look like me didn't know that's what that was. And so I was trained back in the day by Gail Tully, who is who does spinning babies. And so that's a internationally known profession about moving babies in utero. And so she's my mentor, and she was the first person that I took doula training from. So I've gone through probably 3 or 4 different programs as far as doula training is concerned. And so that's one thing, really wanting our doulas to be trained with evidence-based information, and encouraging them to keep also just studying and training. So yes, Patty.
Yeah, I was curious if you could talk a little bit about what is involved in the training, like I know that curriculums may differ a lot, but in general, what are the kind of basic knowledge and skill sets that doulas are learning and expected to excel at? Yes.
So I do. So I am a trainer for common sense midwifery, and so we do physical, talking about the physical body and what happens in the different parts of the body. Because when people are trained through common sense, they're trained as a doula, a childbirth educator, and also a lactation educator. And so they get those 3 certifications. And so I personally do the doula piece and the childbirth education piece. And then we have a board certified lactation consultant that does the lactation piece. Our training with like homework and things like that, and taking the test, it ends up being like over 40 hours worth of training. And so people are trained about the body, about the history of midwifery. They're talked about about newborn care. And we train people about how to communicate, and so how to listen, how to bring people out of their shell so they can talk. We talk about culture too. And so since I work for the Cultural Wellness Center, that's an important piece that I bring and share with my students here in the cities. I'm really talking about the different cultures and about people's own culture and how them knowing their own culture will help them in their birth work. And so it's a variety of different things. We meet for the training that I'm responsible for. We do 4 days of training, and it's 8 hours every day. Oh, yep. Hi, Jolene. So yes, so that's with my training. But I think most trainings around the country do similar kind of things.
Yeah.
People try to really make sure that people are well educated and really talk about following and doing evidence-based information that's out there.
And really knowing like the labor process is like one of the I feel like the bigger things to know, just because especially with the world of inductions these days, which I'm not judging anyone for being induced, but a lot of the times it's like sold to people as like, you come in for an induction in the night and then you have your baby the next day. And so really knowing that it can be like 3 to 4 days before you have a baby sometimes. Sometimes it does work out that way, but just like making sure that doulas know the process so they can relate to their clients. Like this is the actual process. It depends on time. You may not have a baby within 24 hours.
Mm-hmm. I know that for us too, we talk a lot about community and really talking about people being in community and appreciating that and starting to go back to being able to depend on their community to help them raise their child. And so we do talk about that a lot. Yes, Nicole.
Hi, Akamari. There was a request in the chat from Sadie Swenson. She writes, if you have time, I'd love to hear about how you work in collaboration with family home visiting nurses and programs.
Okay. I love working with family or home visitors. I love working with community health workers too. I think that that's an important piece to be able to have a team of people that are working with the family and being able to have that kind of relationship kind of built. It's so important because you can bounce stuff off of other people if you have the family's permission to be able to talk with other people just about what's going on and how you can help your family the best way that you can. I know I've done work in the community really to talk about just even community health workers, really trying to educate community health workers just about maternal and infant health, and how it would be so wonderful to be able to have a community health worker be able to have a specialty, and so that they would work with moms who are having having children, people who are having children, and have that especially be able to help people to have the kind of births that they want to have.
Thank you, Akamari.
Helpful?
Thank you. There's another question in the chat from Jennifer, and she says, can you talk more about HIPAA, what HIPAA looks like as a doula? Like what laws or legal obligations do you have, or are you bound to in the profession?
We are not. I have not signed any kind of HIPAA anything, but as a professional doula, I do not discuss my clients with other, like by name or by, I may like run a situation by a colleague, but I don't share like names and all of that kind of thing. But as far as HIPAA, There's no law. I don't know laws that I follow.
We do go through HIPAA and we do talk about that.
Yes, we do talk
in
about
training.
it. Yeah.
And that it is, we don't talk about our clients. And
Yeah.
so we do talk about that and make sure that people are clear about that. And even when you're talking to a client about not using names, and even just talking with them just about when they go to the doctor, what do they already know about HIPAA? And so making sure that people understand the HIPAA laws and what their provider is supposed to know and do. So
Yes.
it is covered in the trainings.
Thank you.
But we don't do any like,
We don't have people sign stuff off.
right, and we
anything
don't do
that.
like medical procedures or anything like that. So I feel like it's a little bit different because we're just doing like emotional and physical support.
Mhm. What about family home visiting?
Oh, so she says, thanks for the information. One follow-up question. Are you aware of any family home visiting programs that employee and doula and offer both a doula and a family home visitor? And what outcomes have there been?
I know that at this point in time, I know that what are they? It's north. Oh, it's escaping me right now. There's some talk over, I know in North Minneapolis, they're talking about whether or not they are interested in having doulas participate in their programming.
Oh, NAS?
Actually, NAS, thank you. I had a brain fart. I'm gonna be 60 on Sunday. So I had a brain fart. So NAS is talking about that, about looking at doulas and incorporating them in their work. They also are doing stuff with Northside Family Connection, so Way to Grow too. And so having those kind of conversations with them. So it's starting to happen, but not, it's not something that's popular. It has been happening.
Yeah. Slowly but surely.
Yeah.
It says, could we speak to about if how we work with clients who have been or are being actively harmed, like a domestic violence or sexual violence? We've talked about this in the training as well. And that kind of goes in the communication piece, like making sure you're kind of like watching, you like when you're having in person, it might be harder in virtual, but in person visits, like, you know, looking at body language and just trying to have those moments alone sometimes with the person and just ask those questions like, how, like, are you okay? Like, you know,
What can I do to help? I think that's one of the reasons why it's important for, and I really try to encourage the doulas that I train to really work with other kind of resources in the community, know what's in their community, and be able to meet other people who do other kind of work, other kind of nonprofit work, other kind of organizations, meet people, talk to people, get a friend within that organization so you can do warm handoffs to people. So if somebody has an issue, somebody needs a food shelf, you know somebody at the food bank that can help them be able to have a warm handoff. And so even with the domestic violence piece, talking to people in the community who do that work, and you're able to hand people off, because and make sure that they follow up and follow through with the people that you work with. Yes, Patty.
So kind of as a follow-up to that great question, is a lot of people have trauma in their past. And I feel like having the support of a doula can help people through their pregnancy with dealing with past trauma. Is that true? Like how would that look in your work with clients?
Yes, that's so important. I know for myself, I like to work with people as early as possible so we can have those conversations. So it doesn't bother me to start meeting with somebody in their first, even second trimester, just so you can start to help them be able to work through those things, especially if someone has already had a baby and they had a really hard labor and birth or just pregnancy just in general, being able to talk to them just about that and what we can do to be able to help them be able to have the kind of birth that they want. And so really encouraging people to have those kind of conversations. But that's, once again, it's about also having other resources too that you can offer to people to be able to point them in to be able to get that kind of support if there's something that you know that you can't provide for them.
Yes. And I also say, like, sometimes it's like we don't even know because they don't want to talk about it. And sometimes these things come up in labor that we have had no idea about the whole entire pregnancy. And so, at least for me, it's just really like, I kind of talk about it anyway a little bit, like, here's some like breathing techniques we'll talk like we might do during labor, because I've had moments where like a client may say like, oh, I have like a little bit of anxiety, and then they're in labor and it's like, no, this is like a whole like traumatic thing like from their past that is now present in labor, and that can sometimes stall labor, or like you'll be like in the middle of labor and then all of a sudden something triggers your trauma and you stop.
Yeah.
And so just really making sure we're like talking through those things so that we can help not hold it in.
Right.
And then that sometimes helps labor start back
Right.
up. It's wild. The body's wild.
Yeah, but it's also too just about being able to have that kind of bond with your people.
Yeah, totally.
So that you get that vibe when somebody feels off, and you're able to talk to them just about that and be able to talk them through. And so it's about listening to your own inner voice and the feeling that you might have with somebody, you know. And so you're able to kind of pick that up, but that's a learned skill.
Mhm.
And so it's about how many people you work with and who you're working with. So I saw somebody had their hand up. I'm not sure what their question.
We have Cooper Dyer with her
Yes.
hand up. Cooper, go ahead and ask your question. You might have to unmute yourself.
Sorry, I see that must be a mistake, but I do have a question
Mhm.
regarding that trauma that comes up during pregnancy. I mean, during labor, would you advise to talk to your client about mental health during their pregnancy then, prenatally?
I do. I mean, I do. I talk about it like, you know, even in meet and greets when they haven't really hired me yet. I'm like, we'll talk about like, you know, mental health stuff, and you know, if you have anything that you want to let me know, like it's good so that we can just talk about it. And also when I have my clients do like an intake form when they do a contract with me. And so sometimes they'll put it in there if they're not as comfortable like talking about it out loud yet. So maybe they'll put in there like, you know, I have this that I want to talk about maybe at some point. So not to like, I don't want to push them uncomfortably, right? And make them think that I'm like Dr. Mary's saying, like it's a lot about trust. So just working with them in their timeline, but also like trying to help them before they go into labor with it. And I've only been a doula for 3 years, so I'm still learning and I'm still kind of like getting my footing with that, because I think also with the pandemic, more and more mental health stuff is popping up that I didn't really have my first year being a doula.
Yeah, I think too, I know that I have like a couple of forms that kind of ask different questions to be able to help to get at some of that stuff too. Asking people things about how have they ever been in the hospital before? Have they ever had to stay in the hospital? Because that's a big thing. If people are afraid of hospitals, this is a totally different kind of experience. You're just at the hospital, I have a baby. You're not sick. And so really making sure that people understand that, talking with birthing people just about how do you feel being unclothed, that kind of stuff. So you can help people be able to understand and be able to talk through that stuff. What else can they do then if they have if they have feelings around that? And so being able to have people really trust you and be able to talk to just about any kind of rituals that they might want to do through birth, anything that they want to have said for the baby, around the baby, making sure the baby is never by themselves, that the baby has to leave the room. And so, covering all that kind of stuff with folks. And then also too, this is BC, before COVID, being able to talk with people just about like who else is supporting you, making sure that if the birthing person's mother is going to be there, making sure that she knows that you're not trying to take their place, that you're here to support the whole family and especially support them so they can support the birthing person. And so just those kind of questions and things to be able to talk with and be able to have happen. And so this stuff can happen too if you're just meeting somebody for the first time, because sometimes you're just called into a hospital. You have to figure out how do you bond with somebody that quickly that they trust you too. So that has to be kept in mind also.
Yes.
Because we don't always just work with somebody over a period of time. Sometimes you meet that person at the last minute.
Like we back up each other sometimes. So like if I'm at another birth, I have a partner who will go to that birth for another birth for me. And so, or I'll go to one of her births like that. So it's that kind of thing. Like probably have not met the person.
Yes. It's important to have a backup too. To always have a backup. So anything else?
So how we support the partner and family, I think we should talk a little bit more about that, because I feel like a lot of, like you were saying, sometimes like mothers or mother-in-laws or parents will feel like we're taking the place, and sometimes partners can feel like that too. So I always really encourage all prenatals, like make sure your partner's there if there's a partner, because I want them to be involved as possible. I also tell my clients, as like in the meet and greet, usually like I'm your doula, so I'm supporting both of you. So the person having the baby is obviously focused on having the baby, and the partner is focused on the person having the baby, so not only am I supporting the birthing person, but I'm reminding the partner, have you eaten? Have you drank something? Do you want to rest? Do you need to go take a walk around? All those things, because they often forget about themselves. It's very easy for them to forget about themselves. And then I also teach comfort techniques at one of my prenatals. So I'm mostly teaching the partner those comfort techniques, because I'm usually not there in early labor, because that can be different amounts of time. I may like come in the early labor and get like some positioning done, but a lot of those earlier comfort techniques, I'm showing the partner, like, here, this is like where you press, like this is how you press, like, make sure you're hugging each other, and affirmations, oxytocin is what's going to get this baby to come out. So if you're comfortable, like, kiss, hug, rub each other, those things. But really making sure that I'm like talking to both of them and making sure they're both fully involved.
Yes, definitely. Because if the birthing person is worrying about their partner, they're not focusing on their own body and what's happening. And so I
And that
always
also
make
can stop
sure,
labor.
yeah, I always make sure that I tell the birthing person, I'm here to make sure that he's taken care of. So you don't have to worry about him. I'll make sure he eats. I'll make sure, that nobody messes with him, and that, that he's respected. Because we still do have that issue also, that our partners, they're not being respected or talked to. So making sure that they're talked to. I saw in the chat where somebody had mentioned something about when would you be called in by a healthcare provider. If you have a relationship with a clinic or with a particular midwife or even a OB, they might call if they have somebody who they think would benefit from your support. At this point in time, doing some work with Hennepin Health, where we have a virtual doula program. And so they call people in the middle of the night. If somebody wants a doula, they'll call and get that person to come in. So, yes, Patty.
So just to kind of follow up on that, you've mentioned, Katie's mentioned a couple of times that hospitals or facilities have not always been welcoming to all doulas. And I know back when I first started working in this field, 15, 20 years ago, even midwives would kind of feel like, our role is to be supportive of the mother. And so they didn't necessarily embrace doulas at the beginning. And that has changed a lot in my view. But I know that it also might vary by facility or even by nurse or by provider quite a lot. But can you talk a little bit about what can facilities do to be more welcoming to doulas? What have you seen facilities or hospitals or clinics do that has been really positive, and what's worked well?
I'll just say one thing. When I was talking about that before, I was mostly talking about as a Black doula, being Black, and telling my Black clients of experiences I've had and past Black clients. So not necessarily all doulas. My experience at Maple Grove might be completely different for a white doula, for example. But I would love for there to be more collaboration with doulas and medical professionals, nurses, OBs. I feel like midwives are a little bit more in the know about how important a doula can be to someone, but not as much and some nurses, but not all nurses. And so just really making it known that I'm not trying to be a nurse at all. I don't know how to do the charting. I don't know how to do all the, I can't do an IV, any of those things, I'm there for the person, just mental support, emotional, hands-on techniques, positioning. That's what I do. And I also help with lactation once baby's born. So just really knowing that I'm not there to take their place. I'm not trying to push them out of the room. I'm just solely trying to support my client. And so I'm just knowing that if there's a doula, they're not there to make your job harder. They really want to work with you to make this birth simple, easy, which sometimes I think is the hardest part, right? So for me at least, nurses think I'm trying to be the nurse, and I'm really not. Yeah.
I would agree with all those things you said. And just to add, I'm trying to make your job easier. So you don't have to worry about her and keep coming back to check on her, because I got her for support, to make sure that she's not always pushing the button because she can't or doesn't feel like walking over there to get her bottle of water. You
Yeah.
know, I'm here to do that kind of stuff, or I'm here to make sure that she goes to the restroom. So, or, you know, walks around, moves around, that kind of stuff. And so checking to make sure that they are, that they're, you know, being able really to help them, support them. So I don't know if there's any other slides. Would you have something else, Patty?
Yeah, I was kind of going to follow up, like, so to me, it would be nice to have that relationship with the clinic prenatally too. So can you talk about, you know, how you would work with the woman's OB provider? You know, do you go along to appointments? Do you share information back and forth? Is that a situation where you might get a release of information for the clinician?
Right. I am open to that. I know I personally, I go to doctor's appointments with my client. I usually tell them I can go to as many appointments as they want with them. So I can sit in and be able to hear, because people shouldn't go to the doctor by themselves anyway. That's just anybody. Somebody else should be there to be able to hear what's being said. And so you can have a conversation about it and talk about it. And what did you hear? What did you hear? And so really, so I go to doctor's appointments with my clients. I like the physician or the group of physicians or the midwife to know that they do have this support person that they can call on, or at least be able to say, can you talk with her about this or mention this, or, you know, even just to get a, that's right, you know, from you or from the doctor, that what the person is saying is correct. And so I know that I go to appointments with folks. I'm currently going to every appointment with a play niece that I have, who's having a baby after having twins. And so going with her to each one of her appointments just to make sure she's okay.
Yes, I also offer that to my clients, and will also offer to go to like their postpartum visit if needed, especially if I know that they're having some struggles, just so that they're like making sure that they're asking the right questions and that they're getting adequate answers, because we see so much of, you know, we're seeing more and more like postpartum complications. So like, you know, okay, have we made that, are we making that doctor's appointment like now instead of 6 weeks? Like I can come with you, I can make sure we're asking all the questions. Because sometimes when you get in that presence, you can like forget. And that's speaking for myself too. Like I get to the doctor, I'm like, what was I here for again? Like all the questions I had. And just making sure that they're being heard. Like I always tell my clients, if you tell them like something's happening and they're not listening to you, you just ask them to write it in your chart that you asked them X, Y, and Z, and they didn't want to like serve you, so that it's noted in your chart. And either A, they will do the things that you're asking for, or B, it's in your chart in case anything should happen that you need to, you know, later have evidence of, I guess.
So kind of as another follow-up with clinics, if, so we talked a little bit about the fact that even though it's not great, there is Medicaid reimbursement for doulas. And I think a lot of clinicians don't know that. So we're trying to work on that a little bit. But like if a clinician is working with a woman in their OB, you know, providing prenatal care, what would be a trigger, or what would be kind of an alert that they should think about suggesting a doula for the woman to work with, or to make a referral to a doula agency or something like that?
If they think that the person isn't, seems overwhelmed, if they're not being supported, if they are new to town, those are a few that I can think about right offhand. If they just think somebody just needs somebody else, if they need a mother figure, a sister figure, just somebody to who's got somebody's back. basically, I think.
Agree. I think everyone needs a doula. So I think it should just be something that's talked about. I mean, it's up to the birthing person, obviously, to go and if they really want one, or if they want to have more information. But at like the 8-week or 12-week appointment, it should be like one of the things like, and if, you should hire a doula, like they're great support, like what for when you can't see me, or like if you have questions that we aren't open to answer, or like you need more support, because I have heard of like doctors' offices who say like they won't work with clients if they have a doula, and it's just like, I don't know why it has to be like that. Like, why can't we just all work together? Because we all do different things,
Yeah.
But I would love for it to be more of like a initial topic in the like first appointments that people have with their providers.
Mhm. I saw in the chat, somebody had asked too, just about other kind of things people do, doulas do postpartum. Can you speak a little to that? I can too, because you're a postpartum doula.
It varies. So there's daytime postpartum and overnight postpartum. And so I have done daytime, and that's mostly like going to make a goal with that person for the day. Like, what is one thing you would love to do, like to get done today? And maybe that's like a shower, or like a 30-minute nap, or, there's a pile of laundry that I just haven't been able to get to, or I went grocery shopping and I have all these fruits and veggies and I need them like cut up, or like meal prep. So we'll do those things. And also for evenings, I don't talk to the client that much, obviously, because I'm coming in like just getting like a heads up of the day, and then they're going to bed most of the time. So I go and ask about them right away. Like, how are you doing? Like, you can tell me about the baby, but I want to know how you're doing. Like, how's your mental health? And just, if I know that they have been dealing with anxiety, how's your anxiety been? Like, you told me you were going to the therapist the other day. How did that visit go? Do you feel like that therapist is really listening to you? Do you feel like you're getting good support from that therapist? Do you want, like, if not, do you want me to like research some other options? Or, what have they told you about this, this, and this? If I have a client who's at a C-section, how is your scar healing? Like, how are you feeling about, like, are you making sure that you're not lifting too much? Or a lot of the questions are like, they're postpartum bleeding. Well, how much did you do today? Did you do a lot today? That's probably why you're having like an increased, bleeding. Or just really asking some of those questions that maybe they don't even really think about, because they're just thinking about the baby all day. Because it's really easy for us to forget about ourselves when we have little babies. So just someone asking those questions to just really make sure that they're like, oh, you know what? I didn't eat a lot today. And I'll be like, okay, well, I'll make you a snack plate to take up to bed, before you go to bed. And making sure that like dishes are washed, their pump parts are washed if they're pumping, or that like formula is all safe, sanitary, all those kinds of things, just whatever they're using. And then obviously like holding babies, which is the perk of the job, right? Holding the little babies, and sometimes helping them with the sleep schedule, those kinds of things, all sorts of things.
And I think even beyond that, I've had people call me year and a half later. They may have a parental question, just about a parenting, either weaning or something like that. And so being able to answer those kind of questions, and even if the mom is feeling some type of way, going to take a visit with her, have tea with her, see what's really going on. What can I do to help support you? Might be looking for childcare maybe for the first time. Where do I go? How do I even begin that process? And so talking with them even beyond that.
And not all postpartum doulas are the same. So there are some that like really do a lot of meal stuff. So most of their postpartum is like bringing meals and nourishing the clients through meals. Or you may have like a postpartum doula who is a body worker, so they do massage. So more of their postpartum looks like coming to do a massage on you and then maybe a baby massage, you know, so there's all different kinds of doulas as well.
Yes.
This is my youngest.
Gorgeous.
Oh, you saying hello?
Does anyone else have any more questions for Kamiri or Katie?
Well, I'd like to thank you for this opportunity. It's
Yeah,
been
thank you
good
so
to
much.
be able to talk, to be able to talk about what we do, because we do love what we doula. And the doula, International Doula Week starts the 29th. So
Yes.
hug a doula if you know a doula.
Yes. Or
Hug a
buy a
doula.
doula a cup of coffee
Yeah.
because we're probably tired.
Yes.
That's awesome. Well, we really appreciate you sharing your wisdom today. This has been so informative and I really appreciate it. So I'll just do one more plug as you log off today. The evaluation will pop up and you can complete the evaluation for us. Someone is asking.
Is there a way to get our contact info?
Contact information. Yeah, we could, if it's okay with you both, when we send out the link for the live, for the recording, I
Yeah.
could include
Yeah,
that,
that's fine.
if
That's
that's
fine.
okay with you.
Yes.
Wonderful.
Uh-oh.
All right, thank you so much. And have a great day and happy International Doula Week and happy birthday.
Yeah.
Mary.
Yes,
Thank
happy
you.
birthday.
Thank you.
Thank you, everyone.
That was fun.
Thanks to you both.
Thank you.
Great job.
Yeah.
I was way more stressed out than I needed to be.